Hello everyone and welcome back. So now coming towards the topic, the transposition of great arteries. So we are having a scenario that there is a 1 month old infant admitted with history of respiratory distress and central cyanosis. Parents say that he was cyanosed since birth but developed respiratory distress recently. His echocardiography report shows that he has TGA. What is TGA? What is abnormality in it? What are the complications of cyanotic heart disease and names of cyanotic congenital heart disease and the treatment of TGA and at what age? Okay, so we have two types of heart diseases which are congenital. These are cyanotic heart disease and acyanotic heart disease. The cyanotic heart diseases are tetralogy of Fallot, transposition of great arteries, tricuspid or pulmonary atresia, and truncus arteriosus. These are cyanotic heart diseases. The acyanotic heart diseases are ventricular septal defect, patent ductus arteriosus, arterial septal defect, pulmonary or aortic stenosis, and coarctation of aorta. Okay, four cyanotic heart diseases and five are acyanotic. All that start with T are cyanotic heart diseases, while the rest are acyanotic. Tetralogy of Fallot, transposition of greater arteries, tricuspid or pulmonary atresia, and truncus arteriosus. And the acyanotic are ventricular septal defect, PDA, that is pyelonephritic arteriosus, ASD, this atrial septal defect, pulmonary or aortic stenosis, and coarctation of aorta. Okay, so what is the transposition of great arteries? This is one of the cyanotic heart disease. We will discuss this. This is the most serious cyanotic lesion seen in newborn period 5% and they rarely survive. Aorta arises from the right ventricle and pulmonary artery arises from the left ventricle. Associated abnormalities may include VSD, PDA, pulmonary stenosis, or combination of these. And TGA is more common in infants of diabetic mother and in males. Now, the abnormality or pathophysiology is that there is desaturated blood reaching from body to the right side of heart, passes through aorta and back to the systemic circulation again. Oxygenated pulmonary venous blood returning to left side of the heart is returned directly to the lungs through pulmonary artery. The systemic and pulmonary circulation consist of two parallel circuits. Only means of survival in this newborn is minimum of oxygenated and deoxygenated blood by persistent of patent foramen ovale and ductus arteriosus or VSD. Now the investigations are done, that is chest x-ray, ECG, echocardiogram and arterial blood gases. The medical management is that there will be prostaglandin infusion started immediately in a dose of 0.05 to 0.20 to maintain the patency of ductus arteriosus. Hypothermia should be corrected as it intensifies the metabolic acidosis from hypoxemia, and prompt correction of the acidosis and hypoglycemia is essential. In infants with heart failure, the usual anticongestive measures including digoxin, diuretics, increased caloric density of the formula, and afterload reduction are helpful. The surgical management are that all patients with the favorable anatomic and hemodynamic criteria should be offered corrective surgery by age of 2 weeks. And raised can procedure or balloon atrial septostomy is initial palliative performed by the rupturing arterial septum through fossa ovalis with balloon catheter. Mustard procedure involves insertion of an intra-atrial baffle which redirects the systemic and pulmonary venous blood to aorta and pulmonary artery, and the total repair by arterial switch technique having TGA with intact ventricular septum. Okay, so this was about the transposition of the greater arteries. It is a cyanotic heart disease in which the transposition of the great arteries occur. We are having the scenario. The clinical features will be respiratory distress and central cyanosis. And the cyanosis is present by birth, but the patient developed respiratory distress recently, and echocardiography report shows that he has TGA. So these are the cyanotic heart diseases: truncus arteriosus, tricuspid or pulmonary atresia, transposition of greater arteries, and tetralogy of Fallot. And these are the acyanotic heart diseases, that is VSD, PDA, ASD, pulmonary or aortic stenosis, and correction of aorta. So this was about the transposition of greater arteries. That is the most serious cyanotic lesions, and it is seen in newborn period of and 5% are and they are rarely survive. Aorta arises from the right ventricle and pulmonary artery arises from the left ventricle. Transposition takes place here. Associated abnormalities may include VSD and PD and pulmonary stenosis, and TGA is more common in infants of diabetic mother. Now, the pathophysiology is that desaturated blood reaching from body to the right side of heart passes through aorta and back to systemic circulation. And oxygenated pulmonary venous blood returning to the left of the heart is returned directly to the lungs through pulmonary artery. This has investigations option, that is chest X-ray, ECG, echocardiogram, and arterial blood gases. This is a medical management, that is prostaglandin infusion is started immediately. Hypothermia should be corrected. Prompt correction of the acidosis is done. And in infants with pallor, use anticongestive measures. These are the surgical treatment, that is all patients with favorable anatomic and hemodynamic criteria should be provided corrective surgery, and rest kind procedure or balloon atrial septostomy is initial palliation performed by rupturing atrial septum through fossa ovalis with balloon catheter. Mustard procedure involves insertion of an intraatrial baffle which redirects systemic and pulmonary venous blood to the aorta, and total repair by the arterial switch technique having TGA with intact ventricular septum.